Well, it looks like we have a couple more people continuing to trickle in, but we'll go ahead and get started and they can join um, as they do. So just by point of introduction, I'm Jordan Smith. I run the Institute of Outdoor Recreation and Tourism up here at Utah State University in Logan. And I'm also joined by Liz Soja. You might be able to see on your screen right now. Liz is the program coordinator for the GNAR initiative and has really been instrumental in setting up all of the webinars and information sessions that we've been able to hold so far. So if you're new to the GNAR network, just give you a little bit of background on its focus and what we're trying to achieve with the initiative. The initiative is a collaboration amongst different faculty and professionals across the Intermountain West who are all interested in gateway community development and trying to find solutions and identify ways that gateway communities can learn from one another, that they can connect with one another, and that they can have access to relevant research that can help inform their decisions. So what we've been trying to do over the past 5 or 6 months is identify key gateway community leaders across the West, put them in touch with one another through what we're calling listening sessions, and then also host a series of research Q&As and community Q&As that allow those communities to either have access to relevant research that's going on around the West related to gateway communities' response to COVID, or have the ability to connect with one another and learn about policies or practices that those communities are putting in place to respond to the challenges of COVID. So today we are kind of going to launch into one of those research Q&As, and we're really delighted to have Tom Mueller with us. Tom is a faculty member in the Department of Sociology and Anthropology at Utah State University. And over the past several months has been working on this project, trying to quantify the impacts of COVID-19 on the American West and rural communities across the West. So I just kind of want to, before I turn it over, give some idea about the general structure of the format today. We're going to have about 15 to 20 minutes of research presentation by Tom. And then we're going to have about another 10 to 15 minutes open for Q&A. And then we have some discussion points at the end that we would like everyone to stick online for, that we can host a more of a facilitated discussion and really get you engaged with the content that Tom has shared, and starting to think about the ways that what Tom's research project has found are really reflected in your own gateway communities and the gateway communities that you work with. So with that, I'll turn it over to Tom. Tom, thanks for finding all these new secrets of Zoom and being able to actually see your face with the slides as well.
Yeah, no problem. Thanks for having me. As Jordan said, my name is Tom Miller, and I'm excited to share with you some work we've been doing on the impacts of COVID-19 in the rural American West. I want to start out by acknowledging the co-investigators who have been doing this work with me, Katie McConnell, Paul Burrow, Katie Kofall, Justin Farrell, all at Yale, and then Alexis Murjanoff at NYU. So who is this team? What are we doing? We're a multi-university team interested in the well-being of rural Americans. So we have me at Utah State, a number of people at Yale, and then one person at NYU, and we're interdisciplinary. So we have sociologists and anthropologists and a public health researcher, and we're really spread all throughout. So we have me in Logan, we have people in Boise, Denver, Reno, and then people back east in New York City and New Haven, Connecticut. So what is the Rural West COVID Project? This project is an effort to really start completing the picture of the impact of COVID-19 in the United States. The vast majority of the work that's out there is either national or urban in scope, so it ends up being a little bit placeless. However, we know that rural communities are particularly vulnerable to the effects of the pandemic, right? Rural communities have lower access to healthcare. There's a higher portion of health compromised individuals on average. There's elevated poverty in rural places relative to many urban places. And especially in the West, there's these more vulnerable, often seasonal labor markets. And this is an issue because if we design recovery plans that rely on data that's either biased towards urban populations or is just a national snapshot, we're really likely to miss the mark for rural people. And honestly, a major reason for this existing bias isn't because of any animus on people's part, it's because there's a lack of data. It's just really hard to find good information on what's happening in rural communities. And so we're trying to do that here. And it's imperative that we collect this data on these rural impacts so that we can ensure that the recovery efforts that we see going forward really reflect all Americans, not just urban America. So big overview of the project, there's really three portions. So the first is this initial survey of rural Westerners. That's what I'm presenting today. It was conducted in June of July of this year. We're in the process of beginning a series of qualitative case studies in 25 different counties throughout the West of varying economic types. That's going to go through this fall and spring. And then we're going to do a follow-up survey where we try and reach just about as many of the same households as we can in this late spring to early summer to try and track how things are changing or not changing for these people. So what I'm talking about today is our initial survey. So our initial survey is of 1,009 rural Westerners. We define rural here as non-metropolitan counties. So those are counties that have no urban core of at least 50,000 residents, and they're not connected to any other core urban or metro county by 25% or more of commuting. We did a mixed mode survey. We worked with a survey firm called FM3, and they pulled for us a sample of random addresses from the master US Postal Service file. They then matched these addresses against other publicly available databases to try and identify who lived at these houses. And then those people were contacted by phone or email if possible. And if all else failed, we used postcards. We conducted our sampling until this desired N of 1,000 was reached. So this wasn't a pure probability sample, but it was designed using conventional polling techniques to be representative of the underlying population at a sampling error of plus or minus 3.1% at the 95% confidence level. However, as is common with survey research, our sample didn't match the population as well as we wanted. So we also weighted our sample by age, sex, Latino, Native American, education, and state. And it's those weighted results I'm going to be talking about here. Just to give you an idea, so we use the 11 Western states that you can see that have orange counties in them. These orange counties are these non-metropolitan counties. And just to be clear, it's not that we have someone from every single one of these counties in our study. It's that we pulled addresses from all of these counties as part of our random sampling scheme. And as you can see down by my face here, the time frame of the survey was really during the second peak of COVID in the United States. So this was a time when things were really ramping up all across the United States. Before I get into the results, I want to give a few caveats. So this is, we feel comfortable saying this is representative of the broad rural West, but we can't really break this down by state, county, or region. Due to sample size and the sampling structure and the weights we use, we're really giving a 30,000 foot view. And because of that, some of the specific findings we report here may not match the county you live in, but generally this is characteristic of the rural West writ large. So I wanted to give an outline of the results, so I'm not just throwing things at you. So first I'm going to talk about briefly who is in our sample, and then the direct experience with COVID, perceived impacts of COVID-19, impacts to employment and unemployment insurance, approval of government response. Then we're going to get into attitudes towards various forms of relief spending, and then we're going to talk about outlook for the future. And then I'm going to close with just a few other findings that don't really fit into these. I'm actually not going to talk about who's in our sample because I covered that just a second ago. So we asked our sample about their direct experience with the actual COVID-19 virus. You know, how familiar with you, do people you know, have they contracted the virus? And what we found was that about a third of rural Westerners had direct experience with the virus in some way. So 2% were either formally diagnosed or suspected personal infection, 9% reported a family had a confirmed or suspected case, or 19% reported that a friend or acquaintance had a confirmed or suspected case. So a pretty large portion of the population has had some form of direct experience. When we looked at breakouts by demographics, we found that adults between 30 and 64 were most likely to report some form of direct experience. We saw a little bit of variation by education with less educated individuals having more experience. but we also didn't, and then we didn't see any variation by sex or ethnicity. I'm mostly going to be presenting figures here as much as I can because I think they're more helpful. So we also asked our sample, how has COVID-19, the pandemic, impacted dimensions of your overall life? And we asked them to rate it from 1 to 10, with 1 being extremely negative, 5 being extremely positive, or 10 being extremely positive, and 5 being neither. And then we, for this figure, have grouped them into 3 categories: any degree of negative, any degree of positive, or neither. And what we find, as you can see, is that we really do have a majority saying that there's been a negative impact to their overall life. However, as we get into these 3 specific dimensions, the story isn't quite as clear. It's a little more varied. So for household finances, we actually see the largest group saying there's been neither positive or negative impact. For mental health, we do see the largest group there saying there's been a negative impact to mental health. And then for physical health, it appears the story is mostly not much of an effect. Most people are saying neither. And as you can see on the bottom here, this didn't vary significantly by age, sex, education, or ethnicity. So this is a shared experience, what we're seeing here. We were really interested in how employment has changed for the people living in the rural West. And what we found was in line with the broader national story, but still unsettling. So we found that of those employed full-time in the year prior to the pandemic, 21% were not at the time of the survey. Of this 21%, 50%, half, were temporarily unemployed, and another 28% had been moved down to part-time. And this has ramifications down the line, because what we found also was that 41% of those who were part-time pre-pandemic were not by the time of the survey. And of these 41%, 73% were temporarily unemployed, and only 3% had become full-time employees. So what we're seeing is we're seeing people who were full-time move to part-time, and people who were part-time move to unemployed. And that's basically what we're finding there. We were also curious to see if people were supplementing this loss of work with informal work. So informal work being work that is not reported to the government, that helps you get by either trading goods and services or trading cash. But we didn't really find any change to this. It seemed like that there wasn't much informal work difference between now and pre-pandemic. We did find a corresponding increase to unemployment insurance usage. So in the year prior to the pandemic, only 3% of the survey reported that someone in their household was using unemployment insurance. But at the time of the survey, this number jumped to 13%. And these impacts did not significantly vary by age, sex, education, or ethnicity. We did see some trends that are actually in our report, where we saw that Latinos were less likely to use unemployment insurance if they were unemployed, and women were more likely to be unemployed and be on unemployment insurance. But in terms of statistical significance, they didn't meet the bar. We then asked people how they felt about various responses from sources of government. And this one really found what you would expect. So we saw that President Trump was split in approval and disapproval. We saw that members of Congress experienced wide disapproval for their response to the pandemic. And this is pretty in line with general findings that you'd see. We saw that support for the various state governors was mixed, with a slim amount of more people preferring disapproval. And then we saw a really mixed bag for local officials. And if you were to break this down by partisanship, you would see what you would expect. You would see more Republicans supporting President Trump, nobody supporting Congress, and then the Democrats tended to favor, I believe, the state and local governments. We then were really interested in this idea of support for government relief, especially when the survey was administered. There was a lot of talk about a second CARE Act being passed, and we were really curious about what people wanted to see, especially in the rural West, where there's these kind of narratives of anti-federalism, not wanting handouts, etc. And what we found is that rural Westerners want lots of forms of federal relief spending increased. So we saw massive support for increased relief to small businesses, farmers, healthcare, and infrastructure projects. And then we also saw still a majority of people saying they wanted at least some increase of direct aid to individuals, renter mortgage, and renter mortgage relief. We then dropped down to local governments and relief to clean energy companies, where we see just a little over 40% supporting increases. And then we get to the ones that actually had more people saying they wanted less funding. So the only ones where people wanted less federal relief spending was to state governments, oil and gas companies, and large businesses, with large businesses experiencing very large support for decreasing relief spending to large businesses. And what's interesting here is that these findings are generally pretty bipartisan. So if you look here, this is a selection of 9 of those that I just showed. And if we start at the top, you can see that small businesses, health, and direct aid, the largest group wants to see increased spending. And this actually continues into housing, where we see the largest group for any political affiliation wants more spending. Then we get to local government and renewable energy, where things do start to flip a little bit. We see that Democrats are in both cases far more supportive than Republicans or independents. And then we also see a similar thing for state governments. However, for oil and gas, we once again see that across Republicans, independents, and Democrats, the majority of each of those groups, the largest group among them, is wanting reduced spending, and that also holds for large businesses. So relief spending is good, but if we're going to be coming out of a recession, consumer sentiment matters, right? It's important to know when people are going to feel comfortable spending their money again, because that does drive the economy and pull you out of a recession. And so we asked people about their perceptions of their local county economic health at 3 different time periods. So we asked them how healthy they felt their county's economy was pre-pandemic, at time of survey, and then a year from now. And what we find might be what you'd expect, right? We found that people, the majority said there was some degree of good health prior to the pandemic. Right now, the vast majority say it's poor. So there's been a complete reversal where everybody seems to think, or 58% or so say that it is in poor local economic health. And a good percentage, though, are optimistic and seem to think that a year from now, things are going to be good again. Although it's important to point out that there's still a significant group saying it's going to be poor a year from now. We then broke this out and wanted to see how this varied by group. And we found that when it comes to these economic health perceptions, those with higher education were more pessimistic in all periods, and Republicans were more bullish on the county's local economy in all periods. But what we still saw among these differences is every group did have this positive beforehand, negative now, slight positive outlook on the future. It's just they were lower or higher. And we didn't find that this varied by sex, age, or ethnicity. So there were also a number of other things we asked about that didn't really fit into these buckets that I just showed you. So an important one we asked about high-speed internet. And we found that across the rural West, of households that had children under 16, 18% did not have access to household high-speed internet, which is obviously relevant to all of us on a Zoom call. Among those who were uninsured pre-pandemic, 27% gained health insurance coverage by time of our survey. So it's not that we're seeing people lose healthcare coverage, it's that we're seeing people seem to uptake it, which means they're probably going to the marketplace since there wasn't an increase in employment. And we were curious if people were having to draw more on their credit and savings. So we found very limited effect there, though. We found that increases and decreases were about the same, around 20% of people using their credit or savings. 52% reported no change, and 7% reported they just didn't have access to credit or savings, which is significant in itself. This is a kind of natural amenities group, and so we also did ask about just general natural resource development questions. And what we found is that attitudes towards local forms of natural resource development, they didn't appear to vary or be impacted by how much an individual felt they'd been impacted by the pandemic. It didn't seem like these impacts were enough to really be driving much. Views on these various issues didn't change. We asked people about their support or opposition to increased levels of these 7 different forms of development in their counties. And we found strongest support for farming and ranching, followed by solar, wind, and tourism. And then we found the weakest support, which actually was over into the side of opposition, for logging, mining, and oil and gas increasing in their counties. And this is in line with other research that I've done in Pennsylvania and that others have done in other parts of the country where rural residents are seemingly less and less enthusiastic in their support for these traditional, more extractive forms of development. So I just threw a bunch of results at you, and hopefully they're interesting, but I wanted just to kind of briefly at least say what we think this all means. So we do find that the COVID-19 pandemic has had a significant impact on residents of the rural West, right? This is not just an urban problem. This is not just an East Coast problem. We have seen significant economic impacts. And importantly, these impacts are broadly shared across age, sex, ethnicity, and education. You know, I pointed out a few key breakout differences that we found interesting, but those were basically all the differences there were. The main story here is a shared experience of people struggling with the current economic situation. Many people are out of work, many people are on unemployment insurance, and by and large, people want more government spending in many of the areas we asked about. Given that so many people reported, or 13% reported being on unemployment insurance, the fact that we have seen a reduction and the removal of some of these extension of unemployment benefits means that things may be harder for residents of the rural West than when we initially, sent out our survey back in July, right before those benefits went away. So that's something to think about. Additionally, this issue of incomplete internet coverage, it's important to point out that it's likely impacting those that are already the most vulnerable. Children that are already the most vulnerable, most likely to be poor, are the most likely to not have this high-speed access to internet. There's research that shows this. So when it comes to this online remote education, it's likely that the students who maybe need it the most are having the hardest time with it. And then kind of in closing, with this point, we found that people were optimistic about the future, but current economic sentiment is very poor. Things are going to have to get better and be in line with people's optimism if we're going to see people have increased consumer sentiment and see spending go back up. So zooming back out, this work really starts to complete the picture so that we have an accurate image of what COVID-19 is doing to the whole United States. Obviously, there's lots of other specific findings we need to have. We need to be able to look at state, we need to be able to look at other rural regions, we need to be able to look within this rural region we have here. And we're gonna start doing some of that with the rest of this project. So with our case study work, our Wave 2 survey, I also know there are people in my department, Jessica Ulrichstadt and Jennifer Gibbons, who have done a Utah specific survey, not necessarily just of rural residents, but they're finding things similar to us and have used some of our same measures. So there are people working to try and get more data, but we need to have good data beyond just urban individuals if we're going to have plans that work for people, right? If we design recovery plans without data that reflects the entire population, it's ultimately going to be unsuccessful for the populations left out, which in this case, we're focusing on rural people. So that's all I have for my presentation. I want to thank you all for listening. I want to acknowledge NSF for funding this study, as well as my colleagues at Yale and NYU. The full report is available on our website, covidruralwest.org, and if you have any questions, please reach out at my email address.
Thanks so much, Tom. I would like to note that website is great, and the report that Tom and his team have put together really do kind of encapsulate a lot of the findings that you heard about today. So now I'd like to jump in and offer everybody on the line the opportunity to ask Tom some questions. So if you wouldn't mind turning on your video, if you do have that ability, and you can either just unmute yourself and ask questions, or if you prefer, you can just go ahead and type them in to the chat box in the right-hand side of your screen. There should be a chat dialog that you can open up and ask questions of Tom.
To Lori, we did not ask how, that's definitely something that I think we wish we would have included, but we didn't ask if they support increased tax collection to support that. But I think in Wave 2, that's definitely something on our list, is getting more specific about the specific ways that this would actually happen.
Thanks, Lori. Any other questions for Tom?
This is Suzanne Elger, and I have a question about high-speed internet. What is considered to be high-speed internet?
Yeah, so in this case, we simply asked if they had access to high-speed internet in their home. And let me see here. So generally, when you see the reports on this, they define it as either broadband internet or some form of LTE like you would have on your phone. And so that's normally what is used. I'm going to pull up the specific question that we asked because I don't want to not tell you exactly what was asked about it, to make sure how we defined it for the individuals. Yeah, so we simply just asked high-speed internet, and I think that in the future we might, want to define that a little bit further.
Yeah, I would agree, because I know that we're down in Springdale, and I don't know the numbers, but the numbers that we have are deemed acceptable, but they really don't support all of the needs that the internet demands when you're doing all of the, remote learning and yeah.
Yeah, I fully agree. And that's something that I've heard in other areas as well, as people saying, yeah, we have internet, but it can't do what we need to do. And so I think it's a good idea in the future for us to, especially with having had now more online learning, we can actually ask specific questions like, was your internet able to actually support online learning? We can be really specific.
Yeah.
Thanks, Suzanne. Any other questions for Tom?
Great. Thanks, Corey, for your question. So our main effort right now has been this preliminary report that we tried to make really public facing, and we've sent it to lots of people. Another way we're sharing information is presentations like this. And so that's kind of our initial plan right now. The website and that initial report. We also are writing papers that'll hopefully get this to a broader audience, and yeah, that's about it. Lori, your question. I don't know where you could get exact info that would be identical to what we have here for non-rural populations, and that's one of the things I was actually talking to Jordan about before this. Is we had to focus on rural populations, but it would be really nice if we had the exact same questions asked of urban populations. Generally, though, if you look up any national statistic, it's going to be reflective of the urban population just because of how data is naturally biased by populations. So I think most of the stuff you're going to see on any Google search of the topics that we present here and what's related to it are going to be focused mostly on these urban people.